1,500 divided by 30? Quickly. It's 50. 50 ounces. There are 30 cc's in 1 ounce, and you should have approximately 50 ounces a day of liquids to keep hydrated. That's about 6.5 cups. How do we become dehydrated? Well, if you're sick, you might be throwing up, diarrhea, so you're losing a lot of fluids that way. If you're running a fever, when you're running a fever, you're going to be losing fluid. Higher the fever, the more fluids you're going to lose. You might be on medications, such as diuretics, that are going to cause you to lose more fluid. Let's say you're out exercising. You don't realize how much fluid you're losing, and you don't hydrate yourself as much. If you live in a higher altitude, you're using more to breathe, and that in turn is making you lose more fluid. What are some of the symptoms of dehydration? Well, you're going to be thirsty, very thirsty. You're going to have dry skin. You might get dizzy. You might be constipated. You're not having the fluids to flush everything out of your body. Fatigue. You're going to be tired and fatigued. You might be irritable. So, what are some of the things we can do to keep from being dehydrated? First of all, drink plenty of fluids throughout the day. Keep track. If you're exercising, don't be out in 90, 100 degree weather and exercise and think you don't have to replenish your fluids. If you're throwing up and diarrhea, try to take in more fluid. Who's at greater risk for dehydration? Well, as I said earlier, athletes who are outside or inside exercise are not keeping track of the fluids that they take in. Children, infants, they're smaller, and when they have a lot of bouts of diarrhea or throwing up, it's more traumatic to them. The elderly doesn't have the thirst mechanism that we have at a younger age, and they don't know they're thirsty. Or they might be in a home or a nursing home where they're not provided adequate drinking, and they don't know how, to tell someone, and they can't get up and go get their own liquids. There are some critical signs you need to look for when you should seek medical treatment. In an infant, if their fontanelles are sunken in, diapers, they're not having any wet diapers, are few and far between. You might dizzy, loss of consciousness. So those are some of the things you need to look for and whether you need to seek medical attention.